9,998 cumulative cases of coronavirus in the Victorian community, 723 new since we last updated you. Given the volume, I'm sure you'll understand that breakdowns in relation to those cases will be a feature of the Chief Health Officer media release that will come out later on today. There are 5,385 active cases, 4,516 in restricted areas, so Melbourne Metro and Mitchell Shire, and 255 in regional Victoria. And I'll come back to regional Victoria in just a moment. I'm saddened to have to report that the total number of people who have died because of this global pandemic in Victoria is now 105. That is 13 additional fatalities. To the extent possible, we'll provide you with any additional information, but what I can share with you now, 3 men and 3 women in their 70s, 3 men and 2 women in their 80s, and 2 men in their 90s. We send our condolences, our best wishes, our thoughts and prayers to those families. This will be incredibly challenging. The best at this stage, there's still some confirming work being done, but I think 10 of those 13 are connected to aged care, but we will confirm that later on in the day. In terms of tests, we have now conducted 1,574,626 tests, some 19,921 since we last updated you. Can I thank everybody who's presenting for a test? It's critically important. We're deeply grateful to you, and what that means is we can track the virus, we can put our best efforts to work to try and contain the spread beyond you and your close contacts. But of course, if you're not coming forward and getting tested, we simply don't have that knowledge. We don't have what is central to our most powerful intervention, and that's tracking and tracing all of those positive cases and those that they have come into close contact with. So again, thank you so much to everybody who is coming forward and getting a test. It's very, very important, and it's impressive to think that we have one of the highest testing rates anywhere in the world. More than 1 in 5 Victorians have been tested, and we will only continue that if people continue to come forward and get tested when they have even the mildest of symptoms. In terms of hospital, there are 312 Victorians in hospital. 34 of those are in intensive care. Aged care, there are a total of 913 active cases in aged care. I now want to turn to one other update and then some announcements in relation to regional Victoria. Just in terms of aged care, as I did yesterday, I just want to try and give you some sense of those worst affected aged care settings and some of the interventions that have occurred there. St Basil's is being managed by the federal government, and there's still significant work that needs to be done there and is being done. Kirkbrae, Eastern Health are now managing that facility, and that is, I'm told, that is stable. Outlook Gardens, Monash Health are running that facility now, and that is stable. Epping Gardens, Austin Health are running that facility now, and it too, it is a very challenging environment. There were 2 residents that were transferred. They were emergency transfers to Royal Melbourne Hospital last night. They, I think, have been or are in the process of being transferred to St Vincent's Private. I don't have any further transfer numbers for you or any other narrative on any of those 4 sites, other than to say it's a big team. It's an impressive team in terms of their commitment and their absolute resolve to get in and get the job done, and to all of those nurses and others who are doing that important work, I thank you deeply. It's very challenging, very, very confronting often, and they're doing an amazing job. To all of our partners in that effort, we're equally grateful. There's no lines here. We're all on the same team, and we're all working hard to get this job done. But it is very, very challenging work. To family members, to residents, please know and understand we are, in a joint sense, doing everything we possibly can to provide the care and support that you or a loved one needs. That is not an easy task, but the effort is absolutely enormous, and I'm very grateful to all of those involved. If there's any further updates we can provide you, whether that be later in the day or indeed at tomorrow's briefing, then of course we will do that. Now, I just wanted to update you on ADF door knocking as well. Yesterday there were 30 teams out door knocking positive cases. My latest report is that they have, in cumulative terms, they have door knocked 798 properties. There were 269 that were visited yesterday. Now, I don't want this to be seen as criticism or blame, but I'm obliged to point out that there were a number of people who were not home. They will be referred to Victoria Police. There were also a number of other people who, when there was a discussion, the person that the ADF and the Health Department as a joint team were looking for, the person who has a confirmed diagnosis having coronavirus, they've got a positive test, they weren't home, but a family member was, and the family member helpfully pointed out that that person, a positive coronavirus case, was in fact at work. Beyond that, there were some instances where people were not perhaps clear on what they needed to do. The important thing is that they got that information because they were door knocked. And on the other end of the spectrum, and I'll come back to work in a moment, on the other end of the spectrum there were a number of people who needed scripts filled, a number of people who were running very low on some of the basic household items, everything from some groceries, toilet paper, things of that nature. Because of that visit, we've been able to source all of those things for those people. So as I said yesterday, this is not just about compliance, it's also about us visiting and saying, what can we do for you? What do you need? And I think that's a really important point. None of us should miss that point. That doesn't mean, though, that you are allowed to be out of your home or at work or at the shops if you are positive. If you're a positive case, then you need to be at home and you need to be isolating. And that is a very important message. To have found even one person who had disregarded their diagnosis and instead had decided to go to work is very disappointing. On the broader issue, these numbers today are a reflection of increased cases in aged care. That's one element if you were to break it down. And if there's further analysis and subsets we can put in to the Chief Health Officer release later in the day, we will. But leaving the types of workplaces to one side, because it's not an opportunity, or it shouldn't be read to be an aged care debate. That's not our concern. The key point here is that too many people are still going to work when they have symptoms. Too many people are going to work, even some, when they have a positive test result. That's a small number, though. I think a bigger number are people that are between having the test taken and getting the results. They are still presenting to work. And for so long as that continues, then we will continue to see numbers go up. The only way that numbers will come down and do so steadily is if people, when they are unwell, even very mildly unwell, go and get tested quickly, and then isolate until they get their test result, and then, of course, based on that result, do as they're asked to do from that point onwards. To put it another way, we will not get businesses reopened and we will not see many businesses survive, which is what I want to achieve here. It's what we all want to achieve here, for so long as people continue to go to work when they are unwell. It's not in your interests, it's not in the interests of public health and safety and saving lives, and it's also not in the interests of the workplace where you work, because ultimately, if there is a positive case in that workplace, then that workplace will have to close down. There will be an enormous amount of work, thousands of emails and phone calls and text messages and hundreds of hours of work, contact tracing each and every one of the people who work there, and of course deep cleaning and very significant expenses that will have to be incurred by that workforce, by that workplace, I should say, by that business.